Um, we are here in the EAU Congress in Stockholm, and I would like to present to our Russian neurologist, Professor Guy Bogaert, who is very specialized in bedwetting, different types of everything that is connected to bedwetting in adults in pediatrics. And so, Professor Bogaert, what was new things regarding bedwetting were presented here at the Congress? How do you think?
Actually, right here at the meeting, we specialized in summarizing what happened in 2013, what was published specifically for bedwetting. The first thing is that we always thought that it is very important when you start a treatment with desmopressin, for example, that you should actually limit it slowly by slowly, but apparently you can also stop after you have been taking desmopressin for a while. Another thing also is that the sleep in bedwetting is a very important factor. The quality of sleep of the child is compromised when he would lay in a wet bed. So it is very important either to keep the child dry, or, for example, that the child would wear a diaper. It is very strange because children don't like to wear the diapers, but it is very important that the child wears the diaper, because that way we know now that the sleep quality is improved and is as normal as a child who would not wet the bed. Also very new is that we know that there is also an association with sleep and probably also breathing during the night. Children who would snore, okay, have a higher chance to have also a problem of bedwetting. So if you have a child who wets the bed, you should always ask if the child also is snoring, and they should see an ear, nose, throat doctor to find out if that could be also one of the problems.
And what is your opinion about the recent reports about the impact of polyuria in adults? And as far as I understand that there's some tendency, for example, to pay attention more to polyuria in adults, the same as in children, and using the same medicine for the elderly. What do you think about it?
Well, I think you have to make some kind of distinguish between normal adults, I call it, or elderly people. Because I think when we are adult, we sort of should be able to have a good hormonal balance during the day and during the night. However, in the elderly people, you have a combination of other factors. For example, those people take diuretics sometimes or have other problems. Also, it's not to neglect, for example, but people drink differently. Okay, people should drink in the morning and not so much in the evening. Okay, but of course also elderly people have problems with overactive bladder at night. So I think it's most of the time a combination of both, with polyuria due to different factors, where they can actually influence themselves or not, together with a start of nighttime overactive bladder. I think it's a very important issue, because if elderly people wake up at night and have to go to the bathroom, this is one of the most important problems where they can fall, and then other problems can occur. So I think it is nocturia is a very important issue for the health of the elderly people.
And do you think in future will we use desmopressin also in adults?
I think in certain indications it is quite good that you can use desmopressin. In elderly people, however, in contrast to children, in children we sort of all know that the renal function is normal, but in elderly people you should check electrolytes and indeed look at other morbidities before you just start with desmopressin, but it can improve indeed the quality of life.
And I would like to ask some like a private question. What about your personal opinion about monosymptomatic enuresis? Because as far as I feel that it's not so widespread as we can see. It seems to me that it's not so many people, children have monosymptomatic, really monosymptomatic. How do you think, what's the real rate for real non-symptomatic enuresis? Or those people who has monosymptomatic, they are not very well diagnosed, they're not diagnosed enough?
I think the incidence of bedwetting in children is quite well known. A lot of, how would I say, numbers and articles have been published that the incidence throughout the world is about similar. And as a rule of thumb, I think at the age of 6, there is about 15% of all those children who would still suffer from monosymptomatic bedwetting. At the age of 18, it is a little bit under 1%. So it's an exponential curve. Now, there is a difference between where parents would seek a doctor or not. So it's also about the awareness. Also last year we had quite a couple of articles that have been published about the awareness in parents and what they know, what they think, why the child would wet the bed. It was quite impressive to find out that parents think that the child is lazy, and that is one of the reasons. Also, another study has shown that quite a lot of parents are still punishing the children because they wet the bed. And we were thinking maybe why is that? And it was even shown that people with a good education, they would punish their children. So it's not because, you know, you would not have a higher diploma that you would know why your child would wet the bed indeed.